I'm pleased to welcome to the podium Dr. Barbara Reimer, Dean of the Gillings School of Global Public Health. Dean Reimer is a distinguished professor in the Department of Health Behavior who has conducted research in a number of areas, including informed decision-making and the dissemination of evidence-based interventions and the use of new technologies and for information, support, and long-term maintenance of behavior change. Dr. Reimer is author of over 265 peer-reviewed articles, 55 book chapters, and 6 books, and serves on several journal editorial boards. Dr. Reimer was the first woman in behavioral sciences to lead the National Cancer Institute's National Cancer Advisory Board, a presidential appointment. Dr. Reimer holds a doctorate in public health from Johns Hopkins University and a master's of public health from the University of Michigan. Dean Reimer, thank you so much for being with us today.
Thank you, and I really want to welcome you all, the people that are here and the people that are present from all over the world. I also want to commend the authors and co-authors on a really impressive supplement that we're here to launch today. This is a very important topic, and I think it's one that the average person in the world doesn't know about. And one of the real values of this supplement is going to be to raise the visibility of the issue and to get people talking about an incredibly important issue for us all. As the presenters are going to talk about, falsified and substandard medicines, particularly anti-malaria drugs, are an important issue. It's timely with World Malaria Day, just a few days away. And the economic and health consequences of these medicines is really important. Just to highlight the $75 billion a year that is the criminal enterprise, and probably very conservative in that estimate. $200 billion a year in lost revenues to manufacturers and medical products. And while the issues are especially important for malaria drugs, as the papers show, the problem is much larger than that, and I think part of the value of the supplement is to raise our understanding of both the malaria drugs and the larger implications. And while low and middle income countries are especially at risk because of gaps and weaknesses in regulation and enforcement, we are all at risk, and I think that's one of the really important messages of the supplement. The supplement is going to be an excellent resource for anybody who wants to know more about these issues, and I really commend it to you. I think we also need to recognize that the potential scope of the problem is being exacerbated by the worldwide use of the internet to purchase medications. And that means that even in high-income countries, we are at risk. And the potential also is there to undermine the public's faith and trust in medicines, and that could have much larger implications. Without action on the problem, it's likely to get worse. And the authors of the papers really propose some novel, practical, and potentially implementable solutions, not without cost and complexity, and you'll hear more about that from others. So I want to thank you all for being here today and for paying attention to this really important global issue. Thank you.